Good day everyone, my name is Shalame L. Roble and today I'll be going to discuss health impairments and educational program. First, what is health impairment? Health impairments are due to chronic or acute health problems that adversely affected their educational performance. These problems are present over long periods and tend to get better or disappear. Most health impairments are chronic conditions. The students that have these conditions was limited their strength, vitality that results in limited alertness to the educational environment. Children with these health problems are not usually confined in hospital except during attacks or flare-up of their diseases. In many instances, health impairments results to poor school performance and social acceptance, so that as a future educator, it is really important to be aware of these problems. Among chronic illnesses, common health conditions that may classify health impairments are asthma, diabetes, epilepsy, hemophilia, and burns. So now, let's discuss first what is asthma. Asthma is a chronic lung disease characterized by episodic bouts of wheezing, coughing, and difficulty in breathing due to the inflammation of the airways in the lungs. Meaning, asthma is a condition that affects your lungs. It is a chronic condition, meaning it doesn't go away and need ongoing medical management. Asthma is one of the common long-term diseases of children in which the airways become inflamed. This can make difficulty in breathing, coughing, and whistling sound that is due to the inflammation of the lungs. Exposure to various irritants and substances that usually triggered by allergens and a certain food, irritants and cigarette smoke, and exercise or emotional stress. Symptoms. Children with asthma generally begin in early childhood but sometimes do not develop until late childhood or adolescence. Symptoms might also appear in following viral infection of the respiratory system. Second, diabetes. So what is diabetes? Diabetes is a disorder or metabolism that affects the way the body absorbs and breaks down sugar and starches and food. Meaning, diabetes is chronic conditions that affect how your body turns food into energy. Most food of you eat is break down into sugar, also called glucose, and released into your bloodstream. Children with diabetes have insufficient insulin, a hormone normally produced by the pancreas necessary for proper metabolism and digestion of food. Most early symptoms of children are thirst, headache, weight loss, frequent urination, cuts that are slow to heal. So excessive tears is a hallmark symptoms of diabetes. It's also called polydipsia. And weight loss is a combination of low insulin levels and an inability to absorb sugar from the blood that can lead to rapid weight loss. Third, what is epilepsy? Epilepsy is a conclusive disorder commonly known as seizure, a disturbance of movements, sensations, or consciousness caused by abnormal electrical activity in the brain. Epilepsy, sometimes called a seizure disorder, is a disorder of the brain. Epilepsy is a central nervous system in which brain activity becomes abnormal, causing seizure or periods of unusual behavior, sensations, and sometimes loss of awareness because epilepsy is caused by abnormal activity in the brain. Many children experience a warning sensation known as aura. So what is aura? Aura is a short sensation before seizure. Aura is the term that some people use to describe the warning they feel before they have tonic-clonic seizure. There are several types of seizure, three of which are common, which is generalized tonic-clonic seizure, second, absent seizure, and lastly, partial seizure. So what is generalized tonic-clonic seizure? Generalized tonic-clonic seizure, formerly called grand mal, which is the most conspicuous and serious type. And generalized tonic-clonic seizure, all of the body are affected. Generalized tonic-clonic seizure are usually associated with impaired awareness or complete loss of consciousness. Generalized tonic-clonic seizure is a serious type which is the affected child has no warning that the seizure is about to occur. The muscles of the affected child become stiff and lose his or her consciousness and falls to the floor, then the entire body shakes violently. Saliva may be forced out of the mouth, legs and arms may be jerked, and after 2 to 5 minutes, the contractions became diminished and then the child either goes to sleep. So, this type of seizure may occur as often as several times as or once a year and more likely to occur during the day than at night. So as you can see in the picture, ganyan ang mangyayari sa isang batang mayroong generalized tonic-clonic seizure that all of his or her body that are affected. So second, what is absent seizure? Absent seizure, previously known as petit mal, is a far less severe than the generalized tonic-clonic seizure. So when we say far less severe, hindi gaanong katindi kumpara sa generalized tonic-clonic seizure. Absent seizure may occur frequently as often 100 times per day in some children. So absent seizure involve brief sudden lapses of consciousness. Absent seizure look like he or she is staring blankly for a second, then there is a quick return to a normal level of alertness. And also, the child became flutter, grow pale, and drop whatever he or she holding. That's why the teachers may think that he or she not listening. Third, what is partial seizure? Partial seizure could be complex or simple. Then there is the part of the body are affected. A complex seizure, also called psychomotor seizure, may appear as a period of inappropriate or purposely activity. So partial seizure takes place abnormal electrical brain function occurs in one or more areas of one sided of the brain. The child that have complex partial seizure may smack his or her lips, walk around aimlessly, or shout. And it could last 2 to 5 minutes. Then, the affected child is magkaka-amnesia at di niya maaalala kung ano ang pinaggagawa niya after the incident happened. Then, the simple partial seizure is characterized by sudden jerky motions with no loss of consciousness. It may occur weekly, monthly, or only once or twice a year. So, those are the several types of seizure that are really common. So, as a future educator, when a child experiences one of these seizure, especially generalized tonic-clonic seizure, the teacher should follow this procedure. First, keep calm and reassure that the student will be fine in a minute. As a future educator, if your student having this seizure, first thing you should do is to stay calm and reassure that everything is under control. So dapat walang pagpapanik na magaganap. Second, ease the child to the floor and clear the area around him or her anything. So, dapat sisiguraduhin natin na hindi masasaktan ang ating estudyante. Third, put something flat and soft under the head so that it will not bang in the floor when the body jerks. Fourth, do not try to revive the child and do not interfere with the movement. Fifth, turn the body gently to the side to keep the airways clear and allow saliva to drain away. So, nakakasalalay sa mga guro ang kapakanan ng isang bata. So, those are the things that the teacher should be follow. First, what is hemophilia? Hemophilia is a hereditary disorder in which the blood does not clot as quickly as it should. The most serious consequences are usually internal rather than external bleeding, contrary to popular opinion. So, hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. So, when we say the blood does not clot properly, ibig sabihin, hindi namumuo ng maayos ang dugo, and this can lead spontaneous bleeding o kusang pagdurugo. So, hemophilia is caused by a mutation or change in one of the genes. Hemophilia can result in bleeding within joints that can lead to chronic joint disease and pain. And lastly, what is burns? Burns are a result from household accidents but sometimes caused by child abuse. Children with these serious burns usually experience pain, scarring, limitations of motions, or limitasyon sa paggalaw, lengthy hospitalizations, and repeated surgery. Means burns are the most severe and extensive needs specialized treatment. Children with these serious burns usually experience pain, limitations of movements, and repeated surgery. Burns may result from household accidents but sometimes caused by child abuse. So now let's proceed to the educational program. What is educational program? Educational program is defined as any program principally engaged in the provision of education, especially to those children with have physical disabilities. So this kind of program is to take into consideration both administrative and instructional models of special education. There are 4 administrative models that are appropriate for this group of children. First, inclusion in the regular class. This setting advocates for inclusive education mainly through mainstreaming and full-time placement in regular class. Inclusion in the regular class defines that the students with disabilities have opportunities to learn in the same environment. Second, special class. The special class is composed of children with disabilities who do not meet the criteria for inclusion in the regular class. Special class consisting of students with disabilities who have been grouped together because of similar individual need so that they can receive specially designed instructions. Third, hospital and bound instruction. The special education program is the hospital admits that children with physical disabilities or chronic illnesses who cannot study in regular school. And lastly, homebound or home-based instructions. Children who have severe or multiple disabilities, mobility problems, or chronic illnesses are regularly visited by itinerant education teacher. Meaning, ang mga bata na may malubhang sakit o may kapansanan ay regular na binibisita ng mga guro para sa espesyal na edukasyon. Ito ay napalaking tulong sa pagkatuto ng isang bata. And that's all my report. Thank you for listening.